Everyone, Namaste. I'm Dr. Amrita from AIIMS Guwahati from the Department of Obstetrics and Gynecology, and today I'll be sharing some information about gynecological cancers. So before we begin our session on gynecological cancers, we should have an idea about what cancer is like. Cancer is a state where the body's cells don't function to the optimum level. Everything about them is abnormal, like their growth, their division, their multiplication, the way they function, everything is abnormal. So they divide out of control. The way they function is totally and diametrically opposite to what a normal cell does. So when your cells in the body don't function to the optimum level, your organs and other systems which they're in your body don't work well. So that's why in cancer we say that everything is in a mess. So those cancers which arise from a female reproductive tract are called as gynecological cancers. And as you can see in this photo, we have a picture of female reproductive system. So we have the uterus, and we have something called as fallopian tubes, which is connecting the uterus to some things. These are ovaries. There are two ovaries, one on either side. So from there we come down, which is called as the cervix. This is the mouth of the uterus. And further down we have two parts. These are vulva and vagina. So these are actually called as birth canal, through which the baby comes out during a normal delivery. So out of these 5-6 places, the commoner ones are uterus, ovary and cervix. So while uterus or the endometrial cancer is commoner in the developed world, here in this region, especially the Southeast Asian region, we have cervical cancer, which is the commonest one. So that's why I'm going to talk to you about cervical cancer today. And as we can see in these slides, every 2 minutes a woman is diagnosed with cervical cancer, and they're dying also. So the World Health Organization, that is the WHO, has taken steps to prevent the incidence of cervical cancer from growing up. And we are all hoping that by 2030 we should have a world which is a place free from cervical cancer. What are the risk factors of cervical cancer? Means which are the women who are more prone to develop cervical cancer. So as we can see in the slide, there is something called as human papillomavirus. It's actually a virus which causes around 80 to 90% cases of cervical cancer. And out of all the strains, 16 and 18 are the most virulent, and they cause the majority of cervical cancer in a woman. So HPV infection is a major risk factor for development of cervical cancer. Apart from this, we have women who smoke and who have tobacco, so they are more prone, as well as a women who have lots of children, and those who start their sexual activity early, those who have multiple sexual partners, have an early marriage, or those women who are on birth control pills are also susceptible to develop cervical cancer. Apart from this, there are some immunocompromised conditions like HIV, AIDS, or tuberculosis, which also render a woman more vulnerable to cervical cancer. And the women who live in poor socioeconomic conditions and the ones who have poor sexual hygiene, poor personal hygiene, they are also prone to develop cervical cancer. Apart from this, those who have an unhealthy lifestyle with diets less in fruits and vegetables are also somewhat more prone and are more vulnerable to cause this particular class of cancer. Before we develop cervical cancer, there is a very good time span, like we have around 10 to 20 years in hand after the HPV infection. So these are called as cervical intraepithelial neoplasia, CIN 1, 2 and 3. There are 3 categories before the development of cancer. So if we can detect a woman in these stages when she has not developed cancer yet, but the cells are showing cancerous changes, we can treat them and prevent the cervical cancer from happening. So that's why prevention is more important in this scenario, and we need something called as screening. So screening, as you might have heard about it, it's all in the newspapers and print media now. That screening is something which helps to detect a woman who is particularly susceptible to develop a condition even before she has developed it. Like, I'll give an example. A woman has these risk factors. We know So if we screen them before, we can catch the cervical cancer early. Means we will identify a group of women who are more prone to develop it. We'll catch them early, and we will try to prevent the precancerous conditions which are present in them, so that we can prevent cervical cancer from happening. So by what means can we prevent cervical cancer? There are various ways, there is something called as pap smear or HPV DNA testing, which I'll elaborate in the next slide. We have vaccination, cervical cancer vaccination, and we have, obviously we need to adopt a healthy lifestyle and have a good diet, so let's maintain an optimum weight, and physical activity is also a must, and safe sex practices have to be ensured. So as you can see in this picture, there is something called pap smear depicted here. So what do we do here is we put a brush, as you can see in this picture. So we put the brush inside a woman's cervix, and we try to collect some tissues from there. So we see those tissues and cells under microscope, and then we try to detect the precancerous changes in them. So if she has this, then we treat them so that she does not develop CIN2, 3 or cancer for that matter. So this can be done in two ways: pap smear, as I told now, and something called HPV DNA. This is also like a brush test as in pap smear, but here we see the DNA of the HPV and the human papillomavirus. In countries or in places where there is good access to healthcare, we can start screening in women who are aged 30 years, and it can happen every 5 to 10 years. In poor, resource poor settings, you can start it from 30 years. In good resource places, you can start screening quite early. You can start from 25 years. Same thing goes, every 5 to 10 years at least you should have one screening. And apart from these places where we have access to healthcare facilities, we have field workers, Anganwadi workers or trained staff who can detect changes in your cervix and can refer you to our specialized tertiary care centers where we have gynaecological facilities. We can have a look at them. So, but those cases probably detect them at a much more advanced stage, while we are trying to pick up this woman at a much earlier age. So if you have the access, please do get yourself screened at hospitals with these facilities, so as to be sure that you don't have any changes inside your cervix. There's something called as cervical cancer vaccination. So cervical cancer vaccination is actually given to your children before they start the sexual activity, because sexual activity harbors HPV transmission. So we have to be very cautious in giving this vaccine before the initiation of the activity. This can be given to both males and females, because in males we have HPV cancer, strains causing cancer like head and neck cancer, oral cancer, penile cancer. So we can protect both our boys and girls with this vaccination. Actually, the recommended age is 9 to 14 years. So in this group, we need only 2 doses of vaccination, one at 0 month and another at 6 to 12 months. But care should be taken that there should be a minimum of 5 months between these 2 doses. And from children aged 15 years and above, 15 to 26 to be precise, there is a 3-dose schedule, 0 month, 1 to 2 months, and another at 6 months. So there should be a minimum of gap of 4 weeks between both the doses. And in select scenarios, we can give the vaccine up to 45 years also, but that should be in consideration with other factors like whether you have been already exposed sexually, and then other factors come into consideration. But in some cases, you can still give the vaccination up to 45 years of age. So coming to some symptoms of cervical cancer, some abnormal bleeding which is not related to a menstruation can be a symptom of cervical cancer. Like you have bleeding in between your menses, you have bleeding which is far away from your menses, means that's normal time, that's not the normal time, and yet you still have bleeding. You have bleeding after coitus or after intercourse, then you have bloody discharge, or you have some other discharge which is a very foul smelling, which has a bad smell, which is not white, which is of altered color, like mixed with blood, maybe mixed with some greenish white things, maybe some yellow things. So that can be a symptom. Then you might have symptoms like urinary problems. You might have pressure to pass urine frequently. Then you might have blood in your urine. You might have blood in your stools. then you might have painful maturation, or you may have pain over your lower abdomen, or you can have pain over the backside, lower back to be precise. And all this can be symptoms of cervical cancer. Apart from this, other general symptoms like weight loss, not feeling well, generalized malaise, weakness can also be a sign of cervical cancer. So coming to staging, there are four stages of cervical cancer. Roughly, there are four stages. This has many divisions and subdivisions, but I'll confine discussion within the broad divisions only. So stage 1 is where the cancer is related only to cervix and cervical area. Stage 2 is where it's spread beyond cervix and is reaching up to the tissues of the uterus and nearby structures. Stage 3 is where it's spread beyond the uterus, it's reaching up to vagina or reaching up to pelvic wall, means the side spaces where the uterus is connected to the body. And 4 means it's spread to other distant places like abdomen, your liver, your lungs, your spleen, any place apart from the structures is considered as stage 4. So coming to treatment of cervical cancer, there are so many treatments available in today's scenario, which is seen great improvements in treatment modalities. So we have surgery, we have radiation therapy, we have chemotherapy, and we have something called as targeted therapy. So surgery is mostly confined to early stages up to stage 2 in select conditions, where we see a woman, we test a woman and see her fitness for surgeries and then operate on her. Radiation therapy is actually, initially in the previous times, it was meant only for advanced cases, but now with recent developments in technology and improvement in radiation delivery techniques, we have this treatment which can be given in earlier stages also. Chemotherapy is generally preferred in advanced cases and it's mostly given in conjunction with radiation therapy. And targeted therapy means it's actually we are targeting specific cells which are having the cancerous changes. We are targeting basically them. So these are a bit high-end treatment and this is a little costly. But for the women, for this group of women who don't have who don't have criteria fulfillment for all these modalities, we can send them for targeted therapies. So this was all for today. I hope you could have some information about cervical cancer. So thank you all for your patient hearing.